Okay, so we've had a couple videos in the past where we talked about carpal tunnel, some other areas that present a lot like carpal tunnel. So today we're actually going to talk about how we treat it. So this is how we treat it in the office. So obviously before we treat it, the diagnosis is really important. So we talked about some of the areas that can present like carpal tunnel or can irritate that median nerve. So obviously if it is at the carpal tunnel, this will end up being our main source of treatment. We also consider pronator arteries, thoracic outlet, and then also up at the neck as well. So couple areas that we will be able to test the function of the joints would be at the wrist themselves. Okay, so really important area is radial ulnar joint. So if you kind of look at my wrist here, so we have two layers of what are called our carpal bones. That's what allows us to be pretty mobile here. We actually see a lot of restrictions right below that, and our carpal tunnel actually runs from these outer two carpals here, but mobility here is really important, so we always check and maybe adjust there. Another area is obviously always up at the neck as well. And then we talked about this thoracic outlet, which is bordered by the clavicle and the first rib. We find a lot of restrictions in this first rib, so oftentimes we'll have to adjust that as well. Okay, a couple areas of soft tissue or muscle that we might treat. We can work that carpal tunnel if that's an area. We can work that pronator teres. The scalene muscles, which do fall under that group of thoracic outlet syndrome, and then also the pec, those are all fair game as well. And then something else I forgot to mention too with adjusting, and this is with soft tissue too, obviously we want to make sure that we have a good solid foundation here. So any restrictions in the spine that are going to make it tough for Sarah to be able to maintain, good upright posture, we need to address those as well. So, okay. Something else that we do as well is treatment specific to the nerves. And then another form of treatment would be nerve mobilization. So we essentially want to be able to free up any of those adhesions that do have a hold of that nerve. So we're actually being able to contact at that tissue while we attempt to slide that nerve away from that. So that's typically how we treat these issues in the office. Stay tuned. We'll have another video for you guys. We'll actually show some of the things that we give our patients to be able to take home, some exercise and things like that. So thanks for watching.